Phuket reopening getting up holidaymakers' noses with no less than 5 COVID-19 tests to be paid for. One hotelier on the island expects that only 20% of hotels are open, and with incoming tourists limited to certified hotels, accommodation rates are reported to be significantly higher for tourists considering Phuket as a holiday option at this time with the sandbox experiment. However, it is the intrusive and burdensome public health requirements, including the continued closure of bars and entertainment venues, that have killed the initial excitement and left tourists feeling boxed in. There is growing skepticism about the outcome of Phuket's reopening after it emerged on Wednesday that already fully vaccinated travelers on a 2-week holiday to the island will be subject to no less than 5 COVID-19 tests at their own expense and will have to wait in their hotel bedrooms for the results to come back from the processing laboratory. Phuket Governor Naren Woonsiu briefed the press on Wednesday on final details of the approval given by the cabinet as the Phuket sandbox schemes got a green light, but under a heavy weight of regulation and burdensome restrictions, which has sparked skepticism among many potential foreign tourists over the last 3 weeks, when international interest in the travel trade and goodwill towards plans to reopen one of the world's most popular tourist destinations was initially high. Final details were given by the governor of Phuket on Wednesday after the cabinet, at last, approved the Phuket reopening on the 1st of July to vaccinated travelers. Governor Naren Woonsiu said that he expected to see travelers arriving on the once thriving holiday island from the 1st of July from both America and Europe. However, he only mentioned international flights operated by Thai Airways from Europe, which he pointed out were scheduled from London, Frankfurt, Zurich, Paris and Copenhagen. Undoubted interest among international travelers, but June has seen growing question marks raised by uncertainty and new restrictions imposed. The top official did not reference other planned flights announced in recent weeks by Qatar Airways and Emirates, which had both indicated plans to fly direct to Phuket. There had been undoubted interest among international tourists in traveling to one of Thailand's and the world's favorite destinations without quarantine, especially among fans of the kingdom, prompted by what appeared like opening, brighter skies at the beginning of June. Phuket has herd immunity. Now it will also have international flight connectivity from the 1st of July. Now the situation and outlook appear to be rather overcast following a tightening of conditions, the announcement that bars and entertainment venues on the island will not be reopened, and even more restrictive public health requirements. Officials in Thailand have linked bars to dangerous clusters of the disease. A spokesman with the Center for Covid-19 Situation Administration, CCSA, this week also explained that it was considered people who consumed alcohol find it difficult to follow public health guidance, further raising the risk to public health. Skyrocketing hotel and accommodation costs another big turnoff for those booking holidays abroad. Prospective foreign visitors have also been turned off by the limited selection of hotels open on the island and the additional requirement that all the hotels and facilities being frequented and booked by tourists must have Safety and Health Administration (SHA) plus certification. A top hotelier in Phuket, Suksit Suvanditkal, estimates that only 20% of hotels on the island will be open after July. Hotel boss says many hoteliers will wait and see how the first 3 months go before reopening again. This has meant rocketing accommodation prices, which are reported to be 250 to 400% above normal for the average spending Western traveler to Phuket, which is the market for the reopening scheme at least until the end of 2021. Up to 5 COVID-19 tests for already fully vaccinated travelers within a 2-week holiday time frame. Among the conditions announced by Governor Naren on Wednesday was that all visitors to Phuket will have to undergo no less than 4 COVID-19 tests, starting with 1 on arrival at the airport. This, combined with the pre-flight requirement of a negative virus test within 72 hours of departure, means that all holidaymakers will be subject to no less than 5 tests in the course of just over 2 weeks, even though all travelers entering Phuket will be required, at the outset, to be fully vaccinated with 2 vaccine shots of vaccines approved by the World Health Organization if the passenger or tourist is not booked for 14 days quarantine. It is also being reported that Thai travelers entering Phuket are also now required to be vaccinated and have 1 negative COVID test if they are not going into quarantine. A failed COVID-19 test from among the series will mean immediate quarantine at the visitor's own expense. This is already reported to be creating difficulties for Thais who regularly holiday on the island. Up to May, the cost of COVID-19 tests in Thailand was over 3,000 baht, and it is not known what each incoming tourists will be charged. It is clear, however, that the requirement is an expensive one, and one which will significantly disrupt any holiday break. We do know that anyone suffering a positive test result will be immediately required to move into quarantine at their own expense. Tourists must stay in their hotel room while awaiting the COVID-19 test results from the laboratory. The first test will be on arrival at the airport, the second will be on day 6/7 followed by a third on days 12/13 with one final test on day 14. A further condition, also laid down by health officials, is that all those taking COVID-19 tests will be required to wait for the result in their hotel bedroom in the immediate period after until the lab results are brought back, giving them the all clear. This burdensome regime for holidaymakers comes after visitors will already be required to submit complicated paperwork and information to a royal Thai embassy or consulate, including proof of $100,000 insurance cover, be fully vaccinated at least 14 days before departure, and have the certified results from a negative COVID-19 test 72 hours before departure in the first PAVE to obtain a certificate of entry. This is in addition to hotel costs and the price of a flight to Phuket. Uncertainty raised about Phuket flights after Wednesday's details only referred to Thai Airways. There is speculation about the number of flights that will end up flying into Phuket as a result of the continued uncertainty about the program in recent weeks. This prompted even the Thai Minister of Tourism and Sports, Phiphat Ratchakit Prakhan, to concede that a significant number of cancellations had been caused by potential visitors who simply switched off or went elsewhere. On Wednesday, a spokesman for the Aeronautical Radio of Thailand Limited, which operates air traffic control for the Ministry of Transport at Phuket International Airport, suggested that the organization is only preparing for a 6% increase in incoming flights based on the current number of flights, which has already dropped by 45% for this year already following last year's catastrophic level of activity. Plan in place to curtail or cancel the Phuket sandbox scheme if infections on the island begin to rise and get out of control, as Thailand still faces a threat. On Wednesday also, Natapanu Nopakan, the deputy spokesman at the Ministry of Foreign Affairs, while speaking at a Centre for COVID-19 Situation Administration briefing, confirmed that plans were in place to limit or curtail the Phuket reopening experiment or close it down altogether in the event of a spike in cases. Concerns over nationwide tallies and talk being entertained of a one-week shutdown in Bangkok. It coincides with the kingdom reporting its highest death tally from the disease ever on Wednesday, with 51 deaths and 31 deaths on Thursday reported alongside over 4,000 new infections across the kingdom. The serious nature of the growing threat, with fears of the spreading Delta or Indian variant, currently being examined by top Thai virologists, led the Centre for COVID-19 Situation Administration, CCSA, on Wednesday to concede that the suggestion of a one-week-long lockdown of Bangkok may have to be considered by the country's leadership. If infections on Phuket rise to 90 per week, officials will begin to review the reopening scheme. Mr. Natapanu told reporters that if the infection rate reached 90 cases per week in Phuket, this would be a basis for at least a reconsideration of the reopening scheme, as well as if there was evidence that the disease was widespread on the island or that the outbreak was putting pressure on its hospital beds. For example, if there are 90 persons infected per week in Phuket, that would be a key criterion for reconsideration of the scheme once it has started, or for any adjustments, Mr. Natapanu explained. Also, if all 3 districts in Phuket are affected, and in that more than 6 villages are affected, that would be another criterion. Phuket still recording cases, but the population vaccination rate should help keep cases low. Phuket has seen 712 cases since early April, when the third wave of the virus broke out, which averages at nearly 60 cases a week, leaving at 28th or 77 provinces or areas in Thailand in terms of severity of the virus at this time. It should be noted, however, that since April the province has seen herd immunity achieved, which should significantly reduce the threat. Mr. Natapanu said a key consideration for public health officials also would be if contact tracing ability for infections broke down. Enthusiasm knocked out of the plan by new rules and restrictions, say respondents and potential travelers. Also, if the hospital bed capacity exceeds 80%, that would be another criteria, he further explained to reporters. If the situation becomes worse in Phuket after the opening of the province on the 1st of July with these particular criteria, then it would be reconsidered. No wristbands for tourists, but a tracking app must be used on tourists' smartphones at all times. One requirement which didn't make it to the final announcement was a suggestion that all tourists would have to wear wristbands, but authorities have specified that all must download the More Chana tracking app on their smartphones and allow themselves to be monitored. The province of Surat Thani, including Koh Samui, Koh Tao and Koh Phangan will also reopen from the 1st of July as part of the reopening plan, although the scheme in that province provides for more control with sealed routes and movement limits in the initial 7 days with a short hotel quarantine period at the beginning.